Heart disease is the #1 killer of men and women over the age of 50 in the United States. It claims more lives every year than all forms of cancer combined. And here is the part that most people find genuinely unsettling. The majority of those who die from a sudden heart attack had no idea anything was wrong. They had no chest pain, no crushing pressure, no dramatic symptom that would have sent them to a hospital. The first sign of heart disease for far too many people is a fatal event. But there are signs that appear long before that moment. They are subtle, they are easy to dismiss, and most people and even many doctors do not recognize them for what they are. In this video, we are going to walk through 5 silent signs that your heart may be in danger, backed by clinical research, so that you know exactly what to look for and what to do about it. Before we get into the specific signs, let us take a moment to understand why heart disease can remain completely invisible for so long. The underlying process is called atherosclerosis. It is the gradual buildup of plaque inside the walls of your arteries. This plaque is made up of cholesterol, inflammatory cells, calcium, and cellular waste. It accumulates slowly over decades, often beginning in childhood or early adulthood and progressing silently for years. And here's the critical point. Your arteries have a remarkable ability to compensate. As plaque builds up, the artery wall can expand outward to accommodate it, a process called positive remodeling, which means the channel for blood flow stays open even as the plaque grows. This is why you can lose 50, 60, even 70% of the cross-sectional area of a major coronary artery and feel perfectly fine during normal daily activities. You only become aware of a problem when the narrowing becomes critical, usually when the demand for blood exceeds what the narrowed artery can supply during physical exertion or emotional stress. The other scenario is when a plaque ruptures. An unstable plaque can tear open suddenly, and your body responds by forming a blood clot at the site of the rupture. If that clot is large enough to block the artery completely, it causes a heart attack. And that heart attack can be the very first symptom. That is why the silent signs we are about to discuss are so important. They are signals that this process is underway, even if you feel no chest discomfort whatsoever. They appear in other parts of your body because your vascular system is a connected network. What happens in your heart affects your entire body, and your entire body can signal what is happening in your heart. The first silent sign most people have never heard of is erectile dysfunction in men. This is not something that tends to get discussed openly, but the evidence connecting it to future heart disease is remarkably robust. Here is the biological reason. The arteries that supply blood to the penis are significantly smaller than the arteries that supply the heart. They are about 1 to 2 millimeters in diameter compared to the coronary arteries, which are closer to 3 to 4 millimeters. Because these smaller penile arteries are more easily blocked by plaque buildup, they show signs of vascular disease years before the larger coronary arteries do. In effect, they act as an early warning system for the rest of the cardiovascular system. A landmark study published in the Journal of the American College of Cardiology followed over 9,000 men for an average of 7 years. The researchers found that men who reported erectile dysfunction had a significantly higher risk of cardiovascular events, including heart attack, stroke, and cardiovascular death, compared to men who did not. This elevated risk remained significant even after adjusting for other traditional risk factors like smoking, high blood pressure, diabetes, and obesity. And here's the timing that makes this sign particularly valuable. The study found that erectile dysfunction typically precedes a cardiovascular event by 2 to 3 years on average. That is a real window of opportunity for prevention. If a man over 50 experiences new onset erectile dysfunction, it should be treated not as an isolated issue or something to be managed with medication alone, but as an early warning signal from the vascular system. The same blood vessel damage affecting blood flow to those smaller arteries almost certainly involves the coronary arteries as well. This is not a reason to panic, but it is a reason to have a serious conversation with your doctor about cardiovascular risk assessment and to consider what lifestyle changes might be necessary. The second silent sign is one that sounds almost too strange to be real, but the research behind it is surprisingly consistent. It is called Frank's sign, named after the doctor who first described it in the 1970s. Frank's sign is a diagonal crease or fold that runs across the earlobe. It typically appears at roughly a 45-degree angle, starting from the tragus, which is the small bump of cartilage just in front of the ear canal, and extending backward across the earlobe toward the edge. Multiple studies spanning several decades have examined the association between this physical finding and coronary artery disease. A 2012 meta-analysis published in the American Journal of Medicine pooled data from over 30,000 participants across 27 separate studies. The analysis concluded that the presence of a diagonal earlobe crease was associated with a significantly increased risk of coronary artery disease, with an odds ratio that remained robust even after adjusting for age and other cardiovascular risk factors. So what is the mechanism? That is the question researchers have been asking for years, and the answer is not completely settled. The leading theory is that the same degradation of elastin and connective tissue that occurs in the arterial wall during atherosclerosis also occurs in the earlobe tissue. Elastin is the protein that gives both your arteries and your skin their elasticity. When elastin breaks down, the arteries become stiffer and less flexible, a hallmark of vascular aging. And the earlobe, being a structure rich in elastin fibers, shows this degradation as a visible crease. Regardless of the exact mechanism, the statistical association is strong enough that some cardiologists consider Frank's sign a useful visual marker of increased cardiovascular risk. It is important to note that not everyone with an earlobe crease has heart disease, and not everyone with heart disease has an earlobe crease. It is not a diagnostic test. It is a visual clue that, especially when present alongside other risk factors, warrants further investigation. The third silent sign is shortness of breath during everyday activities that used to feel easy. This is one of the most frequently overlooked early indicators of heart trouble, particularly in women. In men, the classic symptom of coronary artery disease is chest pain or pressure, often described as an elephant sitting on the chest. But in women, the symptoms are often more subtle and far more likely to be dismissed as stress, anxiety, or being out of shape. Shortness of breath, medically known as dyspnea, can be an early sign that your heart is struggling to pump blood efficiently. Here is the mechanism. When the heart's pumping function begins to decline, even slightly, blood can start to back up in the pulmonary circulation, the blood vessels in your lungs. This causes fluid to accumulate in the air spaces of the lungs, a condition called pulmonary congestion. It makes it harder for oxygen to move from the air you breathe into your bloodstream. The result is that you feel winded doing things that never used to cause that sensation. Carrying groceries up a flight of stairs, walking from the parking lot into the grocery store, making the bed in the morning. The key factor is change. If you have always been slightly out of breath, climbing a particular set of stairs, that is your personal baseline. But if something that was easy 6 months ago now leaves you gasping for air, that change deserves attention. A well-known study published in the New England Journal of Medicine followed over 17,000 women and found that shortness of breath was one of the most common symptoms reported in the weeks and months leading up to a heart attack. In a significant number of cases, it was the only symptom the women experienced. The same study found that women who reported new or worsening shortness of breath were several times more likely to have a heart attack compared to those who did not. This symptom is often dismissed as a normal part of aging or attributed to being out of shape. But when it appears without a clear explanation, especially if it is progressive, it warrants a proper cardiovascular evaluation. The fourth silent sign is swelling in the feet, ankles, or lower legs. This is called peripheral edema, and it can be an indication that the right side of your heart is not pumping blood as effectively as it should. Let me explain how this works. Your heart has 4 chambers. The right side, specifically the right ventricle, is responsible for pumping blood from your body into your lungs so it can pick up oxygen. When the right side of the heart becomes weak or damaged, a condition that can develop gradually over time, blood starts to back up in the venous system of your body. Gravity pulls that pooled blood downward into your lower extremities. The increased pressure in the veins then forces fluid to leak out into the surrounding tissues. The result is visible swelling in your feet and ankles. There is an important distinction to make here. This is different from the mild swelling that can happen after a long flight, a particularly salty meal, or standing on your feet all day at work. Those are temporary. They resolve on their own with rest and elevation. The swelling associated with underlying heart trouble tends to be persistent. It does not go away overnight. It may leave a visible indentation if you press on the swollen area with your finger, which is known as pitting edema, and it typically gets worse as the day goes on, improving somewhat after lying down overnight. A study published in the journal Circulation examined patients who were newly diagnosed with heart failure and found that peripheral edema was one of the most common presenting symptoms. Over 60% of patients reported noticeable swelling in their lower extremities before they received a formal diagnosis. The challenge is that swelling can also be caused by other conditions, including chronic venous insufficiency, kidney disease, liver disease, and certain blood pressure medications. So it is not specific to heart disease on its own. But when swelling appears alongside other symptoms on this list, or if it develops suddenly, it warrants a thorough medical evaluation. The fifth silent sign is one of the most easily dismissed, and in many ways it may be the most important one to recognize. It is unexplained fatigue that does not improve with rest. Everyone gets tired. It is completely normal to feel fatigued after a busy week, a poor night of sleep, or a stressful period at work. But the kind of fatigue that signals heart trouble is qualitatively different. It is a deep, persistent sense of exhaustion that feels disproportionate to your activity level. You might find yourself feeling worn out after simple tasks that never used to tire you. You might feel an overwhelming need to rest in the middle of the day. You might notice that your usual morning routine leaves you feeling drained rather than refreshed. Here is why this happens. When your heart is not pumping blood efficiently, your muscles and organs do not receive enough oxygen and nutrients to function normally. Your body has to work harder to accomplish the same amount of work. Over time, this increased effort leads to a constant state of low-grade metabolic exhaustion. A landmark study published in the Journal of the American Heart Association followed over 600 women who had survived a heart attack. The researchers asked them to carefully recall the symptoms they had experienced in the months leading up to the event. Nearly 70% of those women reported experiencing unusual and persistent fatigue. For many of them, it was the earliest symptom they could identify, appearing weeks or even months before the heart attack occurred. And here's the critical point. This is not the kind of tiredness that goes away after a good night of sleep or a quiet weekend of rest. The fatigue associated with declining cardiac function is persistent and progressive. If you find yourself consistently more tired than your lifestyle would reasonably explain, and rest does not seem to fix it, that is worth investigating. Now, here is something I want to emphasize before we talk about what to do with this information. None of these 5 signs on their own means that you definitely have heart disease. An earlobe crease can be a normal finding. Occasional shortness of breath can have many causes. A period of fatigue might be related to sleep quality, stress, or any number of other factors. But when you start to see a pattern, when multiple signs appear together, or when a new symptom appears that you simply cannot explain, that is when these silent signs become genuinely valuable clinical clues. They are not alarms that should send you to the emergency room, but they are whispers, and learning to hear them early can make a significant difference to your long-term health. The research on early detection is very clear. A study published in the journal Circulation found that patients who were diagnosed with coronary artery disease before experiencing a heart attack had significantly higher survival rates over the following decade compared to those whose first symptom was the heart attack itself. That survival advantage came down to one simple factor: having time to intervene before permanent damage was done. So what should you do if you recognize one or more of these signs in yourself? The first and most important step is to have a conversation with your primary care physician. Tell them specifically which signs you have noticed and when they started. They can assess your overall cardiovascular risk using standard tools like blood pressure measurement, cholesterol panels, and blood glucose testing. Depending on your results, they may recommend additional testing such as a coronary calcium score. This is a specialized CT scan that measures the amount of calcified plaque in your coronary arteries. The calcium score is one of the most powerful predictors of future heart attack risk. It takes about 10 minutes, involves no contrast dye, and exposes you to roughly the same amount of radiation as a mammogram. A score of 0 is associated with an extremely low risk of heart attack in the next 5 to 10 years. A high score indicates significant plaque burden and warrants more aggressive intervention. The second thing you can do is address the lifestyle factors that drive plaque accumulation. These are well established, and there is no controversy around them. A diet rich in vegetables, whole fruits, legumes, nuts, seeds, and fatty fish. Regular physical activity, which is one of the most effective interventions for improving cardiovascular fitness and slowing plaque progression. Maintaining a healthy body weight, not smoking, managing chronic stress, and getting adequate sleep. These are not glamorous interventions, but they are the foundation of cardiovascular health at any age. If you are over 50 and you have never had your cardiovascular risk formally assessed, or if you have noticed any of the signs we discussed today, I strongly encourage you to make that appointment. It does not need to be complicated. Start with a conversation. Write down the signs you have noticed, ask about a calcium score scan, and begin addressing the lifestyle factors you can control. That combination of awareness, testing, and action is the most powerful approach we have for preventing the #1 cause of death in this age group. The 5 silent signs we covered are not meant to frighten you. They are meant to equip you with information that could make a genuine difference. Your body sends signals long before a crisis happens. The question is whether you are paying attention to them. If this video gave you something to think about, I would like to know which of these signs surprised you the most and whether you have noticed any of them in yourself. And if you found it useful, consider subscribing. I cover the latest research on health, longevity, and disease prevention for people over 50. Stay consistent, and we will see you in the next one.